Hello, my name is Thomas. I'm a student nurse. I'm going to be giving this baby a newborn assessment today. So I'm going to wash my hands and I'm going to assess or identify the baby. Make sure I have the right one. Okay. And throughout the assessment, I want to keep the baby covered as much as possible because they can lose warmth really quickly. So now I'm going to check its extremities also, see if there's any blue discoloration, adverse cyanosis, which is normal, but we just want to note any. Okay, everything's fine. All right, and now I'm going to check its APGAR score also. This stands for appearance, pulse, grimace, activity, and respirations. This basically tells you how the baby is adjusting to life without depending on the mother. 7 or higher as well, and then 6 or below indicates that the baby needs help. My baby has a 7 out of 10. Now I'm going to check its vital signs too. Listen to its heart rate and its respirations for a full minute. Okay, they all sound normal. The heart rate should be between 110 and 160, and the respirations should be between 40 and 60. And I'm going to check its temperature underneath its armpit or its axillary area. Okay, that's all good. And now I'm going to check the baby's head. So I'm going to check for some facial symmetry. I want to make sure that the eyes, nose are even with the ears and stuff. If they're not, that could indicate substance abuse from the parents or a genetic disorder. And I'm going to take off its cap now. I'm going to feel the sutures and the fontanelles of the baby and make sure there's no like protruding parts or indented parts. That could mean that there's not enough fluid, that there's trauma, or if there's too much fluid. And the corneal suture is the one in the front on the anterior side of the head. It should be in the shape of a diamond. That feels normal. And then there's the sagittal suture, which is in the back of the head, and that should be like a triangle. That feels normal too. And I'm going to check the nasal patency now. So I'm going to cover a nostril, see if the baby still tolerates breathing, and the switch. Okay. I'm going to assess the mouth now also. I'm going to check its palate, see if there's any like abnormal like lesions or bumps or anything. Okay. And I'm going to check its rooting reflex too. So I'm going to touch the side of its cheek. If it turns its head this way, then it's present, and same with the other cheek. I'm going to check its gag reflex also. I can just put a finger in its mouth and see if it tries to like spit out my finger or something, or how it reacts to that. I'm going to assess its skin for any abnormalities like stork bites, which is like a birthmark basically, or hemangioma, which is like a bright rubbery nodule, or like a strawberry patch also. I don't think this baby has any. Check all over its body though, just to be sure. Okay. And I want to know any vernix also, which is like a white creamy biofilm, which can be left on the baby from birth, which is also normal. I don't see any on this baby though. And now I'm going to check for milia on the baby's face, which can just be tiny white bumps. And I don't see any here. And I'm gonna look for Epstein pearls in the baby's mouth. This is like tiny white or yellowish pearls that can be on the gums or on the palate. And I do not see any on this baby, so it's all good. Now I'm gonna check its extremities. I'm gonna look for syndactyly and polydactyly. Syndactyly is when the fingers or toes are webbed together, and then polydactyly is when there's extra toes or fingers. So I'll get there. All good. Okay. Now I'm going to look at the simian crease also. A simian crease is when there's just one crease in the palm of the hand. There's normally 2. One can indicate Down syndrome or there are other disorders. And I'm going to check for palmar grasp now too. So I'm going to place my finger in the baby's hand, see if the baby grabs it. And I'll do that with the other palm also. Okay. And I'm going to do plantar grafts also, which is the same thing but for the feet. Okay. Govern back up. Okay. And I'm going to check its Babinski reflex also. So I'm going to stroke its foot and I'm going to see if it spreads out its toes. Okay. Present. Now I'm going to look at its genital area. I'm going to make sure there's not two of something or if there's any defects in that area. Okay. Everything looks normal. And I'm going to check for hip clicks, so I'm going to push its legs up, forwards, and if I hear any clicks, then that might indicate a problem with its joints. And I don't hear anything, so it's all good there. And now I'm going to check, if it's a female, I'm going to check for pseudomenstruation. Some of the mom's hormones may be still in the baby, and that could come out of the baby's vagina and look like a period, but it's not. I don't see any of that here. And if it's a male, I'm gonna inspect the urethra and the testicles too. I'm gonna make sure that everything looks fine and normal, no complications. I'm gonna turn the baby over a little bit to look at its backside. I'm gonna look for meconium or its first stool. It could be black and tarry, but I'm gonna see if it has passed it yet or if it hasn't. Everything looks good there. I'm gonna look underneath its shirt too. I'm gonna look at its umbilical cord. I wanna make sure that, I just wanna make sure that it's intact and that it's healing okay. If there's any signs of infection, let me cover them back up. Okay. And finally, I'm gonna look on its skin again. I wanna make sure there's no more discolorations to the skin or any grayish areas or dark areas. Its arms or spots I might have missed, like on its back. Make sure you support the baby. Okay, everything looks good there. I'm looking at its gluteal folds too. Babies can have a lot of extra body fat on them sometimes, so you want to make sure you look in every crease also. So we'll spread its legs a little bit. Examine everything. And lastly, again, I'm going to check its temperature.